Dorothea Orem's General Theory of Nursing, or Dorothea Orem's Self-Care Deficit Theory. Definition. It focuses on each individual's ability to perform self-care, defined as a practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being. There are three components: theory of self-care, theory of self-care deficit, and theory of nursing system. So these are the relationships. In the theory of self-care, there is a self-care agency, self-care requisites. They are universal, developmental, and health deviation requisites. And lastly, the therapeutic self-care demand. Theory of self-care deficit, that is, a self-care deficit exists and nursing is needed. Theory of nursing system, it is classified into three: wholly compensatory, partly compensatory, and supportive. First component is the theory of self-care. Here the individual is able to do the self-care. Self-care agency, we'll see in detail. Universal self-care requisites. These are the maintenance of a sufficient intake of air, the maintenance of sufficient intake of water, food, the provision of facilities for elimination, the need to take a rest, the need to have an activity. Developmental self-care requisites. For example, adjusting to new job or adjusting to body changes. Health deviation self-care requisites. These are the changes in human structure and function out of the range of normal and may be associated with genetic variations or other defects. For example, the congenital anomalies. Theory of self-care deficit. It focuses on the 5 different methods: acting and doing for others, guiding and directing, providing physical or psychological support, providing an environment promoting personal development, and teaching. So this is the Orem's model on general theory of nursing. These are the descriptions. Lastly, we move on to theory of nursing system. Firstly, the wholly compensatory system. Here the client is unable to carry out any activities. For example, a person in coma with vertebral fracture, senile persons, or some forms of mental retardation. Partly compensatory system. Patient needs some care, but to some extent. Supportive, here the client knows, but he needs some support regarding the disease condition and the health seeking behaviors. So this is a diagram that represents Orem's self-care theory. So the nursing process would be based on the universal self-care requisites: air, water, food, elimination. So you can read from the slide. So these are the prioritization. According to prioritization, so ineffective breathing pattern, impaired gas exchange, ineffective tissue perfusion, and so on. Thank you.